Hi, my name is Thomas Paavola, and I'm an accredited practicing dietitian at Ellipse Health. Today, I'm very happy to be speaking to you all about what blood test to ask your doctor for and why. As dietitians, we practice something called medical nutrition therapy. This process allows us to assess our patients in a comprehensive way that leads us to identifying their top 4 to 8 nutritional priorities. These nutritional priorities are the main diet-related barriers or problems preventing the individual from reaching their health goals. We then develop personalized diet, supplement, and educational interventions that are targeted at addressing these nutritional priorities. As you may expect, these nutritional priorities will differ from person to person, and the strategies to address these priorities will also differ from person to person. Ellipse Health dietitians put a lot of emphasis on personalized nutrition, and we regularly track subjective and objective outcomes to monitor our patients' progress and ensure they are tracking towards their health goals. A part of our assessment and regular monitoring process involves comprehensive blood testing. As blood tests are a well-established objective biomarker of health and nutritional status, we like to dive deep into the explanation of each individual biomarker so our patients feel empowered to take control of their own health. Over time, many of our patients learn how to interpret their own blood test results and are confidently equipped with a range of simple dietary strategies to help optimize their health biomarkers over the long term. Firstly, all of the blood tests we discuss today should be collected at an accredited pathology lab after a 10 to 12-hour fast, and ideally first thing in the morning before exercising or starting your work. Your individual healthcare professional may recommend additional blood tests that are specific to you and your health status and goals. The blood tests we discuss today are general in nature and may not be the right set of tests for you. In addition, we only use the reference ranges on your blood test report as a guide. These reference ranges are not indicative of the optimal ranges, and patients should be assessed on an individual basis to determine what the most appropriate range for each biomarker is for them. HbA1c. Hemoglobin A1c or HbA1c is the ultimate biomarker for assessing long-term glycemic control. HbA1c is measuring how much glucose has stuck to your red blood cells, as your red blood cells have an average lifespan of 3 months. We call HbA1c a 3-month average of your blood glucose levels. Our body likes to keep a tight rein on our blood glucose levels because if our glucose is too high for too long, it starts sticking to proteins and causing damage. You can imagine that your body has about 1 teaspoon of sugar in your entire bloodstream, and that's what it likes to maintain for optimal health. This is equivalent to a HbA1c of about 4 to 5.6%. Your HbA1c might be on the higher end if your red blood cells live for longer and that live for longer than 3 months, or on the lower end if your blood cells live for shorter than 3 months. There are lots of factors that lead to increases in your blood glucose levels, with the biggest one being dietary carbohydrates. However, I would say that stress comes in at a close second. This is an example of a patient with type 2 diabetes who came to see us with the goal of improving glycemic control and reducing their need for medications. Together with the patient, we set a goal of reducing HbA1c to 6.5% while minimizing or coming off anti-diabetic medications. And we make a plan to retest HbA1c again after 3 months later after implementing dietary change, such as reducing dietary carbohydrates, whilst increasing quality proteins. Insulin. Unless you have type 1 diabetes, our pancreas produces a hormone called insulin to help bring blood glucose levels back to baseline after they have risen. Over years or decades, individuals who are persistently exposed to high blood glucose levels can develop insulin resistance, whereby specific cells in the body no longer listen to insulin, which results in a greater amount of insulin being produced by the pancreas to control blood glucose levels. Between meals and overnight, insulin is supposed to come back down to very low concentrations so that our body can switch over and burn fats for energy. However, in individuals with severe insulin resistance, insulin concentrations in the blood do not come back to baseline and they remain high for many hours. That's why a fasting insulin test is so important. If your insulin is above 10 after you have fasted for 10 to 12 hours, then it may mean you have insulin resistance that needs addressing. Insulin is such an important test to ask for because we know that high fasting insulin levels are a predictor of type 2 diabetes. So by checking your insulin levels regularly, you can be in control of your health and possibly prevent a diagnosis of type 2 diabetes. Here is an example of someone with a very high fasting insulin levels. This result is consistent with insulin resistance, and at Ellipse Health, we would implement a dietary strategy such as a low-carb diet and retest fasting insulin again in 2 to 3 months. Triglycerides. Triglycerides generally reflect how much fat you have floating around in your bloodstream. During the fasting state, we should have very low triglycerides because our body should be using fats for energy, given that we haven't eaten anything for 10 to 12 hours. If your triglycerides are elevated, it probably means your body isn't burning fat for energy. Usually, this is a result of insulin levels being too high for that individual. Again, we often see elevated triglycerides in people for years before they are given a diagnosis of type 2 diabetes. So this is another fantastic biomarker for preventing type 2 diabetes. It is also a good biomarker for understanding what level of insulin is required for an individual to burn fat. So for example, some patients are able to achieve low triglycerides and burn fat at an insulin level of 10, whereas other individuals need to get their fasting insulin down to 6 or below in order to burn fats. HDL cholesterol. HDL cholesterol is often known as the good cholesterol because of its cardioprotective properties. Interestingly, having a high HDL cholesterol, which is generally a good thing, will drive your total cholesterol level up, which is simply the sum of all of your cholesterol. And this can lead to concern by some healthcare professionals who see your total cholesterol coming up as high or in bold red text. That's why it's always a good thing to ask your doctor for a copy of your blood test results so you can assess your biomarkers for yourself as well. HDL cholesterol is actually more strongly correlated with heart disease than LDL cholesterol, such that the higher your HDL cholesterol, the lower your risk of heart disease. Here is an example of a result showing elevated triglycerides at 2.7 and a lower than desirable HDL at 1.2. After educating the patient on the meaning of these results, we would recommend a dietary intervention aimed at improving insulin sensitivity, such as a low-carb diet, and again, retest these markers in 2 to 3 months. A much better test for assessing cardiovascular risk based off cholesterol is actually something called lipid subfractions. This allows you to see the breakdown of different size cholesterol particles, which is much more strongly correlated with cardiovascular disease risk compared to the LDL result on the previous panel we just looked at. In this test result, you can see this patient's total cholesterol and LDL cholesterol is within range, but has a higher number of small, dense LDL particles and a low HDL cholesterol. This result has been classified as a type B coronary risk, which indicates an increased risk of cardiovascular disease. Now, this test is not covered by Medicare, so you should expect to pay out of pocket, but it's certainly a worthwhile consideration. Liver enzymes. Elevated liver enzymes may indicate some kind of stress in the liver, such as a buildup of fat in the liver. The body may start to store excess sugar in the liver as fat if it has run out of other places to store it. This is a sign of poor metabolic function and is one of the hallmark signs of the metabolic syndrome. Your liver enzymes may also be elevated due to certain medications, given that medications need to be processed in the liver. Additionally, an excess intake of alcohol may also lead to fatty liver. Nutrient deficiencies should also be acknowledged because your liver uses vitamins and minerals to help with its function. No one thing in the body is acting solo. This is an example of someone with elevated liver enzymes. I would recommend this patient lower their intake of dietary carbohydrates and alcohol, as well as increasing the nutrient density of their diet. It is also worthwhile discussing these results with your doctor and the potential need for further investigations such as a liver scan. CRP. C-reactive protein, or CRP, is a marker of inflammation. Inflammation is essentially stress in the body. Short-term inflammation is a good thing. You want inflammation to increase acutely to help you heal, repair, and/or fight any infection that you may have. However, your baseline inflammation levels should be nice and low in order for a healthy inflammatory response when you do need it. On the other hand, chronic inflammation, whereby your baseline levels of inflammation are elevated, is said to be the root cause of chronic disease. This is when your body is under excessive amount of stress that it cannot manage. Now, when we say this, many of our patients respond with, "Oh, but I'm not stressed." The thing is, your body is faced with stress every second of the day. And if you have fatty liver, if you have high blood pressure or nutrient deficiencies or poor glucose control, obesity, inflammatory bowel disease, irritable bowel syndrome, or PCOS, or any other health issues, then the amount of stress your body is processing is much greater. In addition, excessive exercise and inadequate energy intakes can also lead to increased levels of stress and inflammation, especially when someone's system is already inflamed. There is never one single cause of elevated CRP, so this should be addressed holistically, and further investigations may be required to rule out other serious medical conditions. This is an example of a patient with ulcerative colitis, which is the type of inflammatory bowel disease. In this case, an anti-inflammatory low-carbohydrate diet intervention was prescribed and CRP to be tested again in 3 months, along with some other more specific inflammatory markers used with inflammatory bowel disease. Iron studies. Iron is a mineral required to oxygenate our red blood cells and to help our body produce energy. Therefore, one of the most common symptoms of iron deficiencies is fatigue. Iron deficiency is so widespread because most people have no idea how much red meat, fish, or organs they really need to be eating on a regular basis to maintain healthy iron status. Some individuals are more susceptible to low iron levels than others, especially if they have high iron losses, such as PCOS or inflammatory bowel disease, or they have poor iron absorption, again with inflammatory bowel disease or with IBS, which is irritable bowel syndrome. This is an example of someone with insufficient iron levels. It's important to assess your iron levels in combination with your symptoms. We have patients that feel best when their ferritin, which is their iron stored in their liver, is greater than 70, while other patients may need their ferritin to be greater than 100 to lose weight and to have no headaches. Everyone is different, which is why the reference ranges on the blood test should really only be used as a guide. Homocysteine. Elevated homocysteine is a cardiovascular risk factor, a marker of inflammation, and a marker of nutritional status. Homocysteine is more strongly correlated with cardiovascular disease risk than cholesterol, so it's super important. However, homocysteine levels are generally not tested. There is no medication to treat high homocysteine, which may be a possible barrier to regular testing. But there are dietary strategies you can implement to lower your homocysteine levels if they are elevated. Homocysteine works in a cycle with your B vitamins. If one of your B vitamins is not functioning adequately, then your homocysteine may increase. The most common B vitamin deficiencies we see in clinical practice are vitamin B12 and folate, which is vitamin B9. This is an example of someone with very high levels of homocysteine. This patient also had a vitamin B12 and folate deficiency, and given the severity of this result, the patient was prescribed activated B12 and activated folate supplementation for 3 months, as well as a nutrient-dense dietary intervention that involved increasing their quality protein foods. Folate, or vitamin B9, is another essential B vitamin that you should ask your doctor to test for when doing blood tests. Inadequate folate can lead to high levels of homocysteine, as I said before, because folate is required to methylate or activate the other B vitamins, such as vitamin B12. Folate also works together with B12 and iron to produce healthy red blood cells. Folate is essential for your cardiovascular system, so individuals with a family history of heart disease should certainly ask to have their folate levels tested on a regular basis. Yes, heart disease is not all about cholesterol. Now, food sources of folate include liver, eggs, nuts, seeds, and cruciferous vegetables. Vitamin B12. Vitamin B12 is an essential nutrient required for the proper function of your nervous system. Vitamin B12 helps to produce the myelin sheath, which cushions your nerves and allows them to communicate with one another. Low vitamin B levels are very common because most individuals are taking some kind of medication that is negatively impacting their absorption. For example, metformin, antihypertensive or blood pressure medications, and antacids all reduce the absorption of vitamin B12 in the gut. Also, as we age, which we are all doing, our ability to absorb B12 steadily declines. Vitamin B12 is only found in sufficient quantities in animal foods, including red meat, eggs, fish, dairy, and organ meats. This is an example of someone with insufficient B12 and folate levels. As you can see, these levels are still within the pathology reference ranges, but reference ranges are not necessarily optimal ranges. So it is always important to review your blood test with a savvy healthcare professional who is going to interpret your blood tests comprehensively and in conjunction with your goals, signs, and your symptoms. Vitamin D. Vitamin D is an essential fat-soluble vitamin that we get largely from exposing our skin to UV rays from the sun. Vitamin D is important for every system in your body, and that's because there is a vitamin D receptor on every cell in your body. Insufficient levels of vitamin D are so common in Australia because everyone is avoiding the sun due to fear of getting sunburnt or due to modern living, which is largely indoors. Low levels of vitamin D can make it difficult for people to lose weight, and energy and mood will likely be poor too. Over the long term, inadequate vitamin D can increase risk for depression and anxiety, disordered eating, certain cancers, heart disease, and also osteoporosis. There is a sunlight sweet spot that individuals must be getting consistently depending on their skin tone. So people with lighter complexions do not need as long in the sun to get their vitamin D, whilst people with darker complexions need much longer in the sun each day to produce vitamin D. This is an example of someone with low vitamin D levels. This patient was educated on the important role of vitamin D and was recommended a specific target for sunlight exposure and suggested to supplement with vitamin D3. This test was repeated again in 3 months to help determine the effectiveness of the intervention. As mentioned at the start of the presentation, it is important to acknowledge that one single dietary approach is not necessarily effective for everyone. That is why, after implementing some diet and lifestyle strategies, it is very important to monitor and evaluate the effectiveness of these over time. As discussed, blood tests are a fantastic objective way to assess progress. Monitoring signs and symptoms is also another great way of doing this. At Lips Health, dietitians put a lot of emphasis on personalized nutrition, and we regularly track subjective and objective outcomes to monitor our patients' progress and ensure they are moving towards their health goals. Thank you very much. I hope everyone watching now has a better understanding on what blood tests they should be asking their medical team to run and why. Thank you.